All right, so we're joined today by Dr. Emilie Reinhardt, who just graduated from College of St. Mary. She's here to just tell us a little bit about herself and her path through PT school. So thank you for being here, Dr. Reinhardt.
You're welcome. Thanks for reaching out and asking for my input and the opportunity.
Absolutely. So tell us a little bit about you, what got you interested in PT, and why did you choose College of St. Mary, kind of the basics.
Yeah, so I've been a PTA for 13 years. Ironically, I had my 13-year anniversary of being a PTA 2 days before graduating, or about 2 days before graduating with my DPT. So that was really a cool milestone to encounter in conjunction with it. Uh, really loved my job as a PTA. I'm completely satisfied with the work that I've done over the past 13 years. It's an incredibly fulfilling position and role to have in the community and the field. I definitely felt early on in my PTA career that I wanted more. I felt a little bit of almost kind of held back from being able to treat my patients to the fullest capacity of what I felt like I was capable of, and recognized through some various PTs in my career that what I was lacking was like continuing on with that PT degree. So they really encouraged me to go back to school. That was around, I was in the field about 4 to 5 years. I was also passed up for a promotion because I did not have a DPT. I was only a PTA. So it's like, okay, this is not going to work. So started the process 7 years ago of going back to school because my PTA degree was an associate's degree. So I had to finish my bachelor's degree and then pursue DPT school. I finished my bachelor's in the summer of 2019, had to take a semester off for some personal health reasons. And then 2020 hit, which kind of slowed down everything for PT schools. But what that also did, though, was really open the door for hybrid programs. And I know College of St. Mary's was already in that first year taking students, but it really, I think, refined how hybrid education for physical therapy and physical therapy assistants was presented. And I was at the time that I was looking at PT schools. I was the director of clinical education for a PTA program myself. And I was teaching in the program and running the clinical education side of things. And my program director, Dr. Julian McGee, we were doing clinical site visits with students. He was getting ready to leave to take a position at WashU in St. Louis. And he said, hey, you need to check out this program out in Omaha. It's a hybrid program. I personally know the director out there, Dr. Kimberly Bernardo. She's amazing, and the program is right up your alley. He said, I think it's really what you're looking for, both in your professional career, but also just in personal side of things. And so checked it out, attended an information meeting that they had online and put in my application. It was the only program that I applied for because when I saw the faculty, when I had a chance to hear from them and hear what the mission of the school and the program was about, I said, this is it. Like, it's them or nothing. And found out then that just about a month after I put in my application, or 2 months after I put in my application, I was accepted, and the rest is history.
That's awesome. Yeah, the faculty over there is amazing. That's the number one reason I chose the school as well.
Definitely. And
Definitely.
no other program in the nation has the diversity and the perspective then from that diversity that the faculty at CSM has, period. It's not found anywhere.
Absolutely. That's
It
awesome.
corners
So,
it.
yeah. So where are you right now? You just finished up clinicals. Kind of what's the game plan right now for you?
Yeah, so I am currently in West Kentucky. I live in Murray. I'm here for about the next 3 to 6 months. I am pursuing residency, neurological residency options. And so those will start around June. If I get into one, if I don't, heads up to anyone who'll be watching, I am actually moving Murray to go move in with my partner in Columbia. So, yeah.
Very cool. That's
Columbia,
exciting.
Missouri, to be clear there.
Not the country.
Yeah, not the country. So.
Well, that's great. Awesome. So you're studying for your boards right now, is that correct?
I am, yep. I am scheduled to take my boards January 29th, 9 a.m., Clarksville, Tennessee. The exact same testing center that I took my PTA license in. So.
Oh my gosh, that's so exciting.
Mm-hmm. Maybe I'll even get the same computer. We'll see. Hopefully.
Let's hope so, right?
Okay,
Good luck. what kind of like study materials are you using? Are you using stuff from the classes that we had? Because I'm entering into that semester where we're going to do all the test prep. So are you using that material? What other kind of like outside material are you using?
Definitely, super great question. And I really struggled, to be quite honest, kind of figuring out what material I wanted to use and how to use it. I started with, while on clinical rotations, using class resources. Really, I saved every single PowerPoint. I used Microsoft Notes to, I forget what the specific program I with Microsoft is, but I could create a notebook for each class. So I did that. In every class, I was uploading the weekly PowerPoints, and then I had a separate page in there for my class notes. So I've got all my PowerPoints from school, and so I just started doing that while I was on clinicals of using class notes. As I got into the fall rotation, I started using Notebook LM, and this is an AI. And I was a little hesitant at first, but it came highly recommended to me. And what's really cool about Notebook LM is that you can submit PowerPoints and notes and even transcripts from a presentation, and it will create study guides. It will create questions. It will create FAQs. It'll create a summary document. And it created them. I was double checking. It was creating to about 95% accuracy. And I was very impressed with this because, AI is an excellent resource, but it does have its limitations. So you have to be cautious and careful of that. So using Notebook LM, I started digging a little bit more into some of the core classes like MSK and neuro, and then cardiopulm. And that really helped me direct my studies a little bit more with the class information. We got access to SPT with me. That's a review course, pretty good. It helped. That was a really good resource for kind of directing where to go. But that was my biggest issue, was kind of knowing what do I need to study, when do I need to study, and how do I study it. And in November, we got to do a weekend score builders course. And that definitely changed my entire studying plan and resources. So in that course, they give you some excellent resources with schedules and then also outlines for reviewing content, which is very, very helpful. It was exactly what I needed. They also taught us how to use the program that they've created, Basecamp, which I 100% recommend. It's excellent. It has multiple study plans available, 30-day, 60-day, 90-day, and then like a whole year study plan where it tells you where in the Score Builders book to read. Then it has flashcards, then it has videos, then it has questions. So it incorporates a very active learning environment. And that's what I've been using. So that's predominantly where I am focusing all my efforts, is with the Score Builders book. I shifted to the Score Builders book for a couple different reasons. When I was taking practice exams, the majority of my errors are just simply academic errors. I don't make a lot of decision-making errors, and I don't make a lot of test-taking errors. Those are like down to under 5 to 10% for me. So I really realized, okay, I really just need academic review. I felt like, based on the information we were presented with in that weekend course, using a bona fide review book that says, here are the facts that you need to know for the exam, that was most beneficial for me presenting the academic content that you need for the exam, versus classroom material really prepared me better for my clinical rotations, if that makes sense.
Yeah.
So that was kind of where I started seeing a little bit of a difference there. And so far, I've really liked using the Score Builders book. It's,
Good.
that big, but it's
Yeah.
great.
I just got mine in the mail.
Woohoo!
That's great. And then, so while you were on clinicals, did you find it hard to like put aside time to also
100%.
study? Okay,
Yeah.
cool.
Yeah. Yeah. I, full admission, did not study nearly, well, I had like hardly any on my first clinical rotation. I think part of that, in a way, I think I probably set myself up for some failure. I made up this huge study plan. And I was like, I'm going to do every day, an hour and a half every day when I get home from the clinic in the evenings. That was just overambitious of myself. because what I had to do was be studying conditions that I was seeing in the clinic. Like
Mm-hmm.
that, I had to devote a certain amount of time to preparing for the next day, reviewing the day, looking at what I needed to work on, also working on our um, capstone project. That took a lot of time, and I didn't plan and balance that well. So,
Yeah. I'm kind of planning to do the same thing where like I don't think I'm gonna study at all on my first clinical rotation,
mhm.
and then I'll kind of start incorporating it during my second rotation, and I do want to take it in January as well. So did you or have you heard of anyone using like Final Frontier or anything like that? Is it worth it?
Yeah, I've got a couple classmates who are using Final Frontier. They really like it. It's an expensive course. I know some of them actually have gotten their job site to pay, like their future employer to pay for it, which is awesome. Go for it. I also know some PTAs who've used it and also experienced immense success on their PTA exam. So, I think companies like Score Builders, PT Final Frontier, they exist for a reason. Like their programs work. So I think whatever program you pick, as long as you stick with it, I think that's the biggest thing. Like stick with it and do the work. I think you should be set up for success.
Okay. Okay. And then you did mention the Capstone Project. Can you
Mhm.
kind of like explain like what that is, what all you have to do for that?
Yeah. So our capstone project was a case study, and it was a poster presentation case study. So within the first couple weeks on your clinical rotation, we had to be picking a patient or a project that we wanted to do a case study on. So whether that was looking at the progression of a specific diagnosis or going, you know what, I want to know how this rehab principle, if I start implementing this principle with this patient population group, diagnosis, age group, whatever, how it affects their progress. You're basically going to do the work of collecting that data and then putting it together in a poster that you present. We eventually created a video that our classmates watched. And then, if it was of a specific caliber, you could submit for publication and presentation at a conference. So,
And you did submit for the
yeah.
APTA Kentucky Conference. And what
Uh,
what brought you to do that?
so APTA Kentucky and also APTA combined sections meeting, which
Oh,
and it
nice.
got accepted for both. Yeah.
Oh, awesome.
So what brought me to do that was for different reasons. Because I do care about evidence-based practice. I mean, that's really, to me, one of the things that it boils down to is I want to be contributing to the field. I felt like what I specifically chose to look at was valuable information that changes the ballgame. Um, and some things when it comes to outcome measures that we're using in the acute care and the inpatient setting. Um, and part of it was also that I wanted to pursue early, working on getting published in different ways. So also working on creating and writing up a journal article. I'm a little bit behind on that because licensure exam. Um, but as I also look ahead at applying for residencies, having that on my resume for residencies is definitely a boost.
Mhm.
Um, Residency application is even harder than PT school application, so whatever you can do to boost that up, um, you've got to put in the work for. So
Yeah, that's definitely a huge bonus. I didn't even think
mhm.
about that for residencies.
Yeah,
Absolutely. And you
and
were
then
looking at neuro residencies?
yeah, I've got a couple that I'm looking at in Missouri, so that put me in close proximity, like I said, to my partner. So,
Very cool.
mhm. But the process for applying to then present, so my main conference location that I wanted to present to was APTA combined sections, and it did get accepted. I'll be in Houston in February. But then also it got accepted at Kentucky. Uh, Very challenging, or I wouldn't say challenging, but it definitely there's work involved. So for the APTA, you have to also write an abstract, and that abstract is what you submit.
Mhm.
And it's that was a fun experience, but it was a valuable experience. So I worked with Dr. Dial She was my faculty advisor for that, and she held me to a pretty high standard that was accomplishable. That was easy to reach if you put in the work. Kentucky was a little bit easier. You just had to submit the name, title, and like a brief description of what it was. So, yeah.
That's so cool. That's such an amazing feat. So congrats on that.
Thank
That's so
you.
exciting.
Thank you. Thank you.
And are you part of any kind of like special interest groups, anything like that?
Yeah, definitely. And I wish, oh my gosh, I wish I had gotten into SIGs a lot sooner. Special interest group, a SIG. So I'm have membership in the APTA. I also have it in any of the sections that even remotely interest me. Because one, if you're a student, many of the sections are either free or they're incredibly discounted, like $10 to add to your membership fees. So I'm part of the neuro section. I'm part of the ortho section. I'm part of the education section. I'm part of intake. I'm part of cardio. I'm part of research. I joined all of them and every one of them that I possibly could. But the ones, and then within those, some special interest groups. So PT Pride, but also the one interest group SIG that I wish from the get-go, and I'm glad you're bringing this up, because if this could be the one thing that I communicate to any and all students, is the Kentucky Student Special Interest Group. If you're a student, if you have a membership in your state, so if you're a member of the APTA and then you're a member of your state, you automatically have access to your student special interest group. And I did not know this until this fall when I happened to be attending the Kentucky state conference, and then just decided, hey, I'm going to go to the student interest group. The Kentucky student interest group does so much for students. There are scholarships available to go to CSM. There are monthly get-togethers for students from all the programs. You don't have to be the point is, you don't have to be attending a school in Kentucky or in any state to be part of that state's student group, as you just have to be a resident of the state. So I've now joined the Kentucky Student Interest Group, so I joined back in September. It's a free group. Again, they did monthly get-togethers, they did drawings, they did scholarships for conference, and that's huge. And what the Kentucky Interest Group was telling me is that there's just very little awareness surrounding it. And so like they've got all sorts of resources to give to students. Students just don't know about it.
Wow. Yeah.
So I would really encourage all students to reach out to your local, to your state chapter, and then find that student group. So, because you can find students to study with, hang out with. Isolation's a big deal and something you have to push back against when you're in a hybrid program. So it's just an awesome way to do that.
That's great. Yeah, absolutely. Because I think I am part of my Colorado chapter. I've just not utilized it at all. So I should probably look into that for sure.
Yeah. Yeah.
Awesome. That's great. Well, what other kind of like advice or anything would you give someone who's going into their last semester right before clinicals? What do you wish you knew going into clinicals? How do you stay up to date on all the material that we've learned in the past, 2 years?
Yeah. So pray. I'm joking. But not. I'm joking, but I'm not. I did wake up every morning with a prayer like, Lord, help me. So, it's a really good question. I was in a unique position in our program in schools that I do have, like I said, 13 years experience as a PTA. Picking up a goni and using a goni, I can do it in my sleep. I can do it with my eyes closed. Literally tested this out with a classmate. They're like, "Can you do this with your eyes closed?" I said, "Yes." Watch. And I was like, I did it. It's just, I use a goni better than I use an ink pen. And manual muscle testing, again, those are instant recall items for me. You need to be studying those things, though. You need to have those instantly available. Because on day one of your clinical rotation, I guarantee you, your clinical instructor will say, get this goniometric measurement. I guarantee you they will do that. I think it's kind of it's a way that clinical instructors kind of use to gauge like how does the student respond to a very unexpected situation when you're asking them to do something, and then just what's their basic knowledge. I would say also reviewing those normal range of motion values so you can easily tell like, okay, this is a little bit off. One of the things that's hard, so I would say like those are three basic things that every student needs to be preparing for no matter where their rotation is going to be taking them. I think then as you're heading into this last semester, knowing what your setting is for that very first rotation and then your second rotation. So for me, my summer rotation was an inpatient hospital. That meant that I was starting to look into pathologies, like not necessarily orthopedic injuries, not necessarily yet not necessarily like what I would expect to see in an outpatient clinic, but okay, what does COPD look like? What does pneumonia look like? What does congestive heart failure look like? Those things. And then I think, again, depending on those settings, inpatient, acute care, skilled nursing, is being able to start quizzing yourself. And this is a really good activity with you, with if you've got a classmate that you can work with to say, okay, I've got a patient who has a total knee replacement. What would that, if it was just total knee replacement, what would that rehab look like? What are considerations for each stage? Like when they're in the hospital, if they may go to inpatient, if they then go to outpatient. All right, you got that. But what happens if they also have COPD? What happens if they have congestive heart failure? Like throw in that pathology that puts the spin and the twist on it, because the reality is that you're not 9 times out of 10 probably not just getting a total knee replacement or a patient with a total knee replacement. They're going to have some other pathology that will put a spin and a complicating factor onto recovery. And maybe something simple as they're diabetic. So just being mindful of blood sugars, being mindful of the healing process and how that's going to be delayed a little bit. Could be something as simple as that. Could be something as they've got congestive heart failure. They have dementia. Like that makes it more complex. So I would say a healthy review of your basic pathologies going back to Patho 1 and 2. Neuro special tests are huge. Cardio, pulm. I know I reached out to Dr. Garavito about this. Because in my second rotation, which was a spinal cord injury outpatient clinic, I used my cardiopulmonary skills so much. They're not patients with specific cardiopulmonary diagnoses, but it's a patient who's got a C4 complete spinal cord injury. It's a patient who has a C3 spinal cord injury. What are those breathing techniques? What are those airway clearance techniques that they need to be learning? Because that's the focus of rehab. Had to do an incredibly difficult, challenging evaluation on a patient who in his late 20s had Duchenne's muscular dystrophy. Yeah. And was like, okay, like the muscles we have at this point, like we're just down to respiratory muscles. Like, how are we doing with respiratory function? Pulling out the stethoscope, pulling out those auscultation techniques that I had not touched in a year or more. But it's understanding that very rarely is a patient just one diagnosis. They're going to have multiple diagnoses, and that's where you start pulling in these different skill sets. I would say studying in the first rotation, I think there's a lot more studying for the conditions you're seeing and preparing for your next day. I would say still try to incorporate intentional studying time, because that will set you up for more success in the fall semester when you really start getting down to nitty-gritty stuff. So I also, huge point, you need to go into your clinicals with goals, period. Have personal goals. Say, I want to get really good at being able to pivot on the spot. I want to get really good at being able to pull out outcome measures like that, being able to recognize what outcome measures test for different things. So have those goals and discuss them with your clinical instructor right off the bat. Tell them, hey, day one, my goals for this clinical rotation is I specifically want to do this. I specifically want this. I specifically want this. Your goal for your clinical rotation should not be just to pass at the level of competent clinician. If that's your goal, you are not going to be successful and you're going to really struggle on your clinical rotation. You need to be shooting above that. You need to be saying, not only will I be a competent clinician, but I'm going to be really good at pulling out those subjective pieces when I'm in a subjective interview. I'm going to be really good at the efficiency of my objective testing. I went into my spinal cord injury rotation and I said, I know for a fact that my manual wheelchair skills are not at the appropriate level for dealing with this very specialized population. And that was my goal. And I can honestly say, met and exceeded that goal. But it made me a better clinician because I was constantly seeking, how do I get better at this? So you've got to have goals. If you can't come up for goals for yourself, reach out to your professors and ask them. That's one of the things I did before my first rotation. I said, hey, I'm struggling coming up with what I feel like I should focus on. And so I reached out to a couple of the professors and said, what do you think? What would you want me to work on? What do you think is a part of me as a clinician that I need to work on? And they gave me insight and they gave me input, and I applied that on my clinical rotation. And it's kind of that difference between passive learning of saying I'm just gonna my goal is to just be that competent clinician versus active learning, which is saying I will be that and I will exceed.
Wow,
So,
I love that. Absolutely. That's so important. I'm glad you brought that up.
happy to share.
Yeah, absolutely.
It's an opportunity to learn. So,
Yeah. And then when I gotta say, I'm pretty nervous going into my acute care setting just because like I had my tech job in an outpatient clinic. I feel like I can do that, no problem.
Yeah.
What was it kind of like going into that inpatient? Like, what was your week one? Are you just observing? What are you kind of like how do you start to incorporate more of yourself taking over the sessions?
Right. Super good question. So, and this is again, keep in mind, like this is just one perspective.
Sure.
First and foremost, have communication with your clinical instructor. You need to be asking, ask, what are your expectations for me on a week-to-week basis, intentionally at the end of the week. And if your CI hasn't offered this, you need to be asking at the beginning of the week, what day can we have a weekly meeting to discuss my performance and what I can be working on for next week? For me, with my clinical instructor, Kylie, that was Thursday afternoon because that's just for the schedule that always worked best for us. But I think having a conversation right off the bat with your clinical instructor saying, hey, how do you want this first week to go? How do you want these first few days to go? With my inpatient, my CI that I had initially, because I was switched to another one about 5 to 6 weeks in, there were a few things that happened there. She was just kind of like, hey, jump in whenever you want. There wasn't a whole lot of structure. And so it's kind of like, all right. And I did. And by the end of the week, I was pretty much doing everything. And it wasn't maybe the best scenario that could have structured out, but it ended up ironing out all right. But I think like just asking, are your expectations for me that I'm taking this eval right off the bat? I think volunteering, saying, hey, can I do this? Can I take this? Some clinical instructors just like, especially if you're coming into a brand new setting, just saying, hey, follow for the day. You have to learn the EMR. Like, and that is a bear. No matter where you go, it's a bear. No matter what EMR it is, it's just a bear. So I think voluntarily taking that initiative, and that's the key. Okay. But the biggest thing, and I talked with my clinical instructor when we were doing my final review, do not be afraid of failure. is the biggest thing. If you're afraid of failure, you're never going to learn. The only time, in my opinion, and I've been a clinical instructor for PTA students for all of my career, so I can also say this. True learning occurs when we fail, when we mess up, because in those situations, we know, oh, I was wrong. Now, there are some significant consequences in some situations if you fail. If you fail identifying a DVT, that's a problem. All right. Like, there are some pretty significant issues. But if you, okay, so volunteer to do an eval. If you screw up the subject part, if that goes like 45 minutes and your CI is like, hey, you got to dial that in, no big deal. So what? It took 45 minutes. All right, trim that down. Okay, you weren't super, don't worry about failing with your objective testing, like with the speed, the fluidity, like that's going to come, but it's not going to come until you screw up and you learn like, this needed to go better. So I think a big factor is taking initiative in your clinical rotation and embracing, in a sense, an opportunity for failure. And I know that sounds weird, but I can honestly say the best growth in my life, professionally and personally, has been when I've been willing to say, I'm not afraid to fail. And even the clinicians on a day-to-day, the competent clinicians in the clinic mess up. I watched it happen. Okay, guess what? It's a practice of medicine. It's not a law of medicine.
Exactly. Exactly.
Yeah. So just don't miss the big things.
Yes.
Miss the DVT. Know that Wells criteria. So.
And then I guess my last question here would just be like, what are you doing during the limbo after you take your boards? And I think it takes a month or so to get your score
1 week.
back if you pass.
1 week to get your
score
1 week.
Back. Yeah. Okay. Because I was kind of like, I want to start working. I don't know if I'm able to before I get licensed.
Mm-hmm. So on that note, depends on the state. Kentucky allows temporary license. So I have a position lined up, ironing out the details with that. And I'm going to be starting in January on a temporary license, but with reduced hours. Because I said, look, I can give you 20 hours a week because I need the other time for studying. I'm not going to screw up the board. So probably for me, realistically, in that week after the licensure exam will probably be mixed emotions of crying, feeling on top of the world, and eating lots of ice cream. Like, we're just gonna be honest. Yeah. So I think a couple people have brought up like, has it set in yet? Like, you're finished, and I've said like, honestly, it hasn't, because I'm just staying so focused on studying. I am doing 6 to 8 hours of studying of academic review a day. I'm here in the library, phones put away. That's the focus. I think it'll hit more like when I take the licensure exam, and then it's like, okay, now you can take a breath. But I still feel I haven't really given myself time to kind of let down. It's just keeping the gas on.
Sure.
So, yeah. And I think like if you plan to test in January, the gas has to be on the whole time. I don't have a life right now. I would love to be spending more time with friends and family now that I'm home. But it's just realistically, one, I've invested almost $1,000 to take this exam in January. That's all the fees combined. And I do not want to have to take it, like wait even more until April if I screw up, something happens and I don't pass in January. That's just not an option. So, yeah.
Well, that's awesome. Well, we're going to put good vibes out there, and you're going to pass in January, and it's going to be exciting.
So,
well, awesome. Well, thank you so much, Dr. Reinhardt. I really appreciate you and your time, your advice, and I'm excited for you. So good luck.
Thank you. So feel free to reach out. Really glad you reached out when you did. So I'm happy to help. I'm happy to give any more in-depth information, tips, tricks. Yeah, happy to help.
Perfect.
So that's what the profession's about, is helping, and it can't stop just when we graduate school. So
yeah. All right. Thank you so much.
You're welcome.